For a child with a cleft lip and palate, again, generally speaking, we can project that depending on what the child needs. Majority will not need any work until maybe around age 6 or 7. Most of this preparation is if they need to get palatal expander in preparation for alveolar bone grafting. Now, I have seen kids who need earlier intervention because right away from some of the earlier screening that there may be teeth that are more at risk of getting lost, and these evaluations are helpful in guiding the surgical decision making about what the appropriate timing for a bone graft surgery. So it could happen sooner depending on patient age, dental development, but again, rules of thumb are hard to apply because every cleft is different and every child is different, every jaw is different, and the early screening gives us the best opportunity to customize recommendations for these patients.